We are recording. I'd like to welcome you all to the July 2022 session of the Erie County Workforce Collaborative Training Series. The Erie County Department of Mental Health is happy to be able to offer these trainings to the dedicated providers in our community to support workforce retention and provide an opportunity for individuals from our provider community to share their expertise. Today, we are so excited to have Christine Slocum, the Housing Coordinator for the Erie County Department of Mental Health, to talk with us about adult single point of access and accountability for housing. The August session, which will be held on Tuesday, August 23rd from 12 to 1, is still in the works. More info will be coming out soon, so please be on the lookout for the training notice and registration. The information will be emailed, or you can go to the erie.gov/mental health website for announcements and registration information. All of the sessions are the fourth Tuesday of the month from noon to 1, and I'd encourage you to all mark your calendars and watch for notices for future events. All of the presentations and recordings for the past offerings are posted on our website, and I'd encourage you to check those out as well. At the end of this session, we'll be asking you to complete a very brief evaluation. We hope you will take a moment to fill this out so we can continue to improve. This is a community collaborative, and we are always looking for volunteers to share their expertise with our community of providers. If you are interested in doing a 1-hour presentation or are interested in a particular topic, you can indicate that in the evaluation and/or contact me at amy.rockwood@erie.gov. This training will be recorded. Everyone is muted, so if you have questions, please put them in the chat box. Kathleen Larson will be monitoring the chat during this presentation, and Christine will be answering your questions as we go along. When you enter your questions in the chat, please include your email address. If there are questions that we can't get to during this session, Christine will be preparing written responses, which will be posted with the presentation and recording on our website. Thank you for joining us today, and I'd like to now introduce Christine Slocum, Housing Coordinator for the Erie County Department of Mental Health, for her presentation on adult single point of access and accountability for housing. Thank you so much, Christine, and it's all yours.
I was muted. Now I'm not.
Excellent.
Sitting there as quiet as I could possibly be, thinking that my microphone was on, and But anyways, thank you so much, Amy, for having me. As she said, I am the housing coordinator for the adult single point of access. Why do we specify adult single point of access? There is also a children's SPOA. It is not my area of expertise, but if you have questions about that, shoot me an email. I can connect you to the staff people who would be familiar with that. As Amy said, this is going to be recorded. And also I would give a shout out to the Erie County Training Collaborative website, because the other trainings have been really, really interesting. So if this is your first time being here, I would recommend making a habit of it. I have learned all sorts of stuff myself, and that was part of the reason I was so excited to get to have this opportunity to talk to you about SPOA. So SPOA. First, we appreciate your time coming to join us. When I was looking at this topic versus the other ones, I was joking, I've got the boring one. I'm not talking about personality disorders, and we're not talking about LGBTQ family dynamics. And, there was no existential discussions here today. But this is hopefully going to be very useful for you, and I appreciate that you took your lunch break to check it out. My goal is that you'll walk away from this presentation with an understanding of the types of housing that we offer through the SPOA. You'll have a sense of what the referral process looks like and how to make it go as easily as possible. We receive somewhere between 1,600 and 2,000 referrals for housing a year. This year, we're on track to be more on the 2,000 side of things. So the more smoother you can make it for yourself and your client, the more efficiently they'll be able to be matched. And as Amy said, please type your questions in the chat with your email address. If we're not able to get all of the questions, myself and the assistant housing coordinator will do our best to reach out to you after the presentation. It might not be quick though, but we're going to do our best to get there. All right, so speaking of housing SPOA staff, there is me. That's my email. My phone number is right there. Honestly, emailing is usually way more reliable to get a hold of me than phone calls, but feel free to call. And then there is also my partner in absolutely not crime, the assistant housing coordinator, Joshua Curry Bascom. He tends to be the person who touches the referrals first, although when he is out of the office, I will do this, or if we just have a lot that day, we need to split duties. If you have questions, reaching out to either of us is equally as good. But let's say you're sitting at your desk and you're like, there was that presentation by that lady. Her name was Christine. Christine spelled a lot of different ways. And then that other guy, he had not just one last name, he had two last names. I don't remember what they were. I have the solution for you. housing@eriespoa.org. It will go to both of us. And should one of us transition from our roles, it will go to whomever is the housing coordinator or the assistant housing coordinator at the time that you're submitting your question. So our direct emails, if you can remember them, and if you can't, housing@eriespoa.org. The philosophy that Josh and I try to take towards working with the community for the SPOA is that if we can help you, we will help you. So if you're describing a situation and maybe we're not the best fit, to the extent that we're familiar with something else that would work, we'll send you in that direction. With the caveat that we have our set of tools, and a wrench is not a great tool for absolutely every task you have to do. Sometimes we're not the right entity to help you with your problem, but we will try to get you in the right direction if that's not the case. We will also be very transparent and honest with you if we think that there are barriers to trying to pursue a particular type of housing, and we will try to give you assistance in figuring out what can be done instead. So we're not musicians, really wish we were. We can't do everything. Again, I really wish we could, but to the extent that we can, we will help. Housing is not the only part of SPOA, so shout out to my colleagues on the care side. We have my supervisor, Nicole Jordan. She oversees the entire operation, and then the assistant coordinators, Andrea Tobias and Ellen Mills. They work on the part of the SPOA that deals with case management referrals, so like Health Home Plus, the referrals for assertive community treatment teams. If you hear ACT teams being thrown around, that's what that means. It's kind of simply stated, it's like the therapist comes to you. More complicatedly stated, reach out to my colleagues because they can speak to it with way more authority than I can. And also the assisted outpatient treatment legal process, they oversee that as well. If you send me a question about those, I will refer you to my excellent colleagues because I don't really know very much about this. I know it keeps them very busy and they're very good at it. And again, if you can't remember who is doing care@eriespoa.org will get all three people at once. All right, so first, why a single point of access? This is a process required by the New York State Office of Mental Health to ensure the community is prioritizing those who have highest need. It's to make sure that somebody has the bird's eye view, and it's not a process by which the most connected or the luckiest are getting the help that they need. Every county has a SPOA. Every county has their own way of doing SPOAs. So in some smaller counties, they may do it by committee. I know of a county that has one housing provider and you just apply directly to that housing provider because why make a committee if everyone's going with the same agency? We're a bit on the big side when it comes to SPOAs, so that is why it is Josh and I. It is our job to make sure that the referrals come through. So sometimes there will be confusion where it's like, well, you know, in Niagara County, they do this. And I'm like, that's great. It works for Niagara County. And that's kind of the cool thing about being able to self-organize is that every community is able to discern a process that works for them. In our community, we are not the service providers. In my personal case, that's probably a good thing. I'm very good with numbers and less good with direct services. My background is homeless services, policy, and planning. Josh's background actually is direct service and homeless housing, but in these roles, we're more matchmakers than anything else. As I said before, there's care and there's housing, and almost all of our programs require a diagnosis of a serious mental illness. So the letter of the law, so to speak, is that you need to have a diagnosis from the DSM-5, and you need to have demonstrable need for extra supports that residential programs will require. In practice, if you have schizophrenia, you pretty much meet that criteria. Same thing with post-traumatic stress disorder, bipolar disorder, and major depressive disorder. Schizoaffective disorder, psychotic disorder, and delusional disorder are also SMIs for the purposes of SPOA eligibility. Things that are not eligible for SPOA are personality disorders, anxiety disorders, substance use disorders, developmental disabilities, emotional disorders, adjustment disorders, so on and so forth, physical disabilities, HIV and AIDS. Those are not eligible for SPOA. Now, that's not to say that if you have bipolar disorder and co-occurring borderline personality disorder, that's fine. You can have co-occurring disorders. Schizophrenia and substance use disorder, that's fine. We do take people with co-occurring disorders, but if you were applying with exclusive borderline personality disorder, we would tell you that you're not eligible for the SPOA. There is an appeal process. Reach out to me directly if you want to discuss that. But with folks that have these illnesses alone, like I said, 1,500 to 2,000 referrals a year typically. There are two programs that are for folks who have substance use disorder and do not require a serious mental illness, and I will discuss those in a moment. Kathleen, are there any questions in the chat so far?
Nothing yet, Christine.
All right, great. So first, a note about mental health residential programs. They are all voluntary. So you might be in a situation where you're looking at your brother and you're like, oh, independent living skills, he's struggling with those. His symptoms are really, really presenting strongly. He's not taking his medication, and I really wish he would. He needs to be in a residential program because he's not, living with my mom is not working out. I have variations of these phone calls all the time. It's a really, really difficult circumstance. The thing that's difficult and hard to accept sometimes is if your brother does not want to live in a licensed facility or supportive housing program, nobody can force him to do this. This is part of a treatment plan that someone is voluntarily participating in. Self-sovereignty is one of the key tenets of mental health treatment. There are very limited circumstances in which somebody can be treated against their will, and mental health residential programs are not one of them. So this means that people who are pursuing the housing, if you are an advocate for them, maybe you're their care manager or a counselor, they really need to be an active part of the decision making that moves forward in this process. We all have ideas about what other people should do with their lives. I know I have all sorts of ideas on what other people should do with their lives. When it comes to mental health residential programs, they don't mean anything unless the person I'm thinking about wants it to. All right, so with that caveat aside, the types of housing that go through SPOA. So they can be separated into 3 tiers: licensed, unlicensed, and emergency. These are varying levels of support. So on one hand, we have like very, very intensive, lots of supervision, lots of support. And on the other hand, it's almost like Section 8 plus case management. So I'll just go from top to bottom for the sake of explanation. Oh, and then emergency, but licensed housing. Now, they require intensive therapeutic support. People who go to different types of licensed housing, sometimes they're people who are coming out of the psychiatric center or the hospital, and they are stepping into more independence, and sometimes they're folks in the community who are stepping into more support. So SCR, That stands for Supervised Community Residence. 24-hour on-site staff. Maybe at night it's not a lot of staff, but there's always somebody there. You're never alone. You share a bedroom with another individual. You're probably in a house with 10 to 14 people. It feels like a house, like if your house had a few offices for staff members off to the side. Kitchen, living room, common spaces. There may be some programming. The folks there will provide support in helping you remember your medication. No one's requiring you to take it though, because again, self-sovereignty is very important in these programs. But there's going to be a lot of engagement towards that. SSCR stands for Senior Supervised Community Residence. Exact same thing as an SCR, but it's for people aged 55 and older to meet needs that older people may prefer. I kind of jokingly say the biggest one is quiet. But otherwise, that staff is going to have more fluency with the circumstances that present with aging and with people who have serious mental illness and who are aging. Supervised community residences are provided by DePaul. They've got 10 beds. Stell has about 14 beds. Don't quote me on that one. Stell is Southern Tier Environments for Living. If you know of someone who wants to live in Gowanda. BFNC has about 50 beds. They are located primarily on the east side of Buffalo, and TSI has about 54 beds located through Amherst, North Buffalo, West Side, and kind of Hamburg, South Buffalo area. Off the top of my head, I don't know where the SSCRs are located, but TSI has one, Stell has one, that one's in Gowanda, and Greenwood has one as well. Greenwood also is known as the Weinberg campus, if you're familiar with them. All right, SROs, single residency occupancy. If I am a resident of an SRO, I am living in a bedroom apartment in a complex that has about 80 other bedroom apartments, or maybe 75, depending on the facility. It is operated by DePaul. DePaul operates all of them. So these are the Seneca one on Elk and Seneca Street, Kensington, which I believe is not too far from ECMC, McKinley, which is in the process of moving, but it's in northern part of Buffalo. And then there's Ebenezer Square, which is actually more of a apartment setup, and that is on the West Seneca, South Buffalo border. They also have 24-hour on-site availability. They will also help you with your medications. They have meal plans. The room itself has it's like a, you know, an SRO, little efficiency apartment. It has a kitchenette and a sink, bed and a stand, and then some common spaces where people can congregate, some community programming, assistance with transportation, stuff like that. So the difference between like an SCR and an SRO is you have a lot more privacy in an SRO. You still have assistance with cleaning and stuff like that, but you can close your door. You don't have a roommate, stuff like that. Then the next tier of assistance would be a supervised treatment apartments. They are abbreviated as TSA in SPOA. Why are they abbreviated as TSA in SPOA? I don't know, but I am not going to change the course of history here. Think lower flat of like a Buffalo double that has 3 bedrooms and a living room and a kitchen. So you have your own bedroom. You're only sharing the living room with the other couple people. Likely upstairs is also folks who are participants in the program as well. These are inspected by OMH. They are usually rented out from private landlords. If you're living in one, you can cook yourself on your own. You can manage your medication on your own. Cleaning is something that you're doing on your own, but you're seeing a case manager a few times a week, depending on your needs. But again, if you need somebody in the middle of the night, there is someone available. You pick up a phone and they are there to call. So a young adult housing, it's an SCR for people ages 18 to 21, focuses, if a senior supervised community residence is focusing on issues of aging, the young adult housing, which is operated by TSI, is focusing on transitioning age youths, life skills so that they can live independently. And then MICA is mental illness, chemical addiction. So There is the Ataria program, which is actually considered a supervised community residence. And then there is, I want to say it's TLOTS, treatment apartments through TSI that focus on folks who are trying to recover from both substance abuse and mental illness at the same time. So any agency can help somebody who has co-occurring substance use disorder and mental illness, but this program is focusing on those issues as a specialty. Any questions about this?
We just had one question pop up. Is there a list of all these types of housing, and can we obtain that?
Yes. It is on the Erie County website, but we can also post that with this later. I don't know if you guys have the opportunity to take like an email list from this and send out stuff afterwards, or is WebEx just keep it a mystery who attended?
I think the best plan is to post it with the presentation. So all of the material will be posted together, and it'll be on our website with the other training opportunities.
Perfect. So that is where to find it.
Oh, one other question that just came in. If someone has substance use with mental health, do they qualify for the SCR, SRO, STA, or only MICA housing?
That's a great question. So they are still eligible, and in the screening process, the providers will be asking pretty much where are you with the recovery. So nobody's expecting perfection because we're all people. No, none of us are perfect. But what I have generally seen is the people who don't get accepted in these programs have uninhibited substance use, and they are in the pre-contemplative phase of recovery. People who are in the process of recovery, if they have active linkages to treatment, demonstrable time of sobriety, perhaps, if they aren't, they will still be able to get into the program and get accepted. But generally, if somebody is like, well, you know, I have schizophrenia, but I'm not actually interested in getting treatment for my alcohol addiction at all, the other facilities may be reticent to admit them because they're concerned that this would be a trigger for the other folks there who are in active recovery. And a lot of the screening process for that is whether or not somebody is, one, eligible, two, would benefit from the supports, three, wants to do it. That wants to do it is a huge piece, but also isn't presenting any circumstances that would pose a threat to the therapeutic environment. So if I have a hobby of punching people, I am not going to be admitted to licensed housing. If I used to have a hobby of punching people, but it's been 5 years and I've got a lot of, turns out it was due to symptoms and I've been pretty good about staying on track for treatment, that's a different story.
All right, one more question. What is the role of staff at an SCR or SSCR? Do they help with navigating the community and medical appointments?
That would be more of the wheelhouse of a care manager. And a lot of people who are in these programs also have care managers.
Thanks, Christine.
Yeah. All right, so SPO is the referral source, and the agencies maintain their own wait list. So we'll get, let's say we'll get 1,000 referrals for licensed housing. If there is a preference for a particular agency among the housing type, we'll send it to whoever the agency is preferred. Otherwise, if it's first available, we take a look at the wait list versus amount of beds available and send it to who we think would be the fastest. Then when the agency receives the referral, they would reach out to you, schedule a screening. They would request some documentation. So for instance, you need a physician's authorization because some of the support services are more akin to like going to the doctor in the world of like Medicaid billing. You need to demonstrate that you need it and that you would benefit. And then if some of the buildings have any financial restrictions, a few of them were built with HUD money. And if you have ever worked with HUD before, you know there is a lot of paper trail required for that. They would work with you for that. Many of these programs require Medicaid and the ability to get the congregate care 2 rate from DSS. This is a residential stipend for people in licensed housing settings. Most of the time, if you're admitted, you'll get it. unless you have a lot of money. Like if you're independently wealthy, you're going to have to pay for this yourself. And you can talk to the intake department at the agency for the details on that. Or there are some circumstances where if you have a hard time getting benefits, and again, that's on a case-by-case basis, I would encourage you and the person you're working with to reach out to the intake department about the specifics of your case. Unlicensed housing. So licensed housing is named such because it is subject to the 595 regulations in the New York State law, and unlicensed housing is not. This includes the supportive housing program. So that is a rental voucher program where the resident pays 30% of their income, and then the program covers the rest. Gee, that sounds like Section 8. Yes, it does sound like Section 8. But the difference is that there is a monthly case management visit, and that case manager's job is to make sure that your housing issues, you have support with them. They're not necessarily going to solve those issues for you. If your lease says no dogs and you decide to bring in a dog, your case manager can't fix that for you. But if you're having some struggles working with your landlord, maybe they can help mediate the discussion, give you tips on how to work with the neighbors. I have seen housing specialists kind of act as just the person's informal support. Like, I need to figure out how to do this. Okay, we'll figure out how to do this. Anything that pertains to housing. And that would be at minimum once a month. Through SPOA, I say there's two main types. There's actually three. So HUD funded, this is the more complicated one, is for people who are experiencing homelessness and have serious mental illnesses. Like I said, with anything that HUD does, it is very specific. So you have to meet the HUD definition of homelessness. You're in an emergency shelter, a place not meant for human habitation, or you're fleeing domestic violence or human trafficking. A referral would be made to the SPOA, but you would also have to go to the community's coordinated entry. It's like SPOA, but for homeless services. It's in the basement of the Buffalo Public Library, and Restoration Society operates that. So what SPOA does is make sure you're eligible, and then coordinated entry will prioritize you based on HUD's rules for how homeless people get prioritized for housing. We have an open bed, we call coordinated entry up, and we're like, hey, we got an open bed, and they send us the name of the next person on their list. Typically, it is that you score over a 9 on the VI SPDAT assessment that they do, and that you've been homeless the longest of all the people in the community at the same time. So that's HUD. Then we also have New York State Office of Mental Health funded supportive housing, which has fewer rules. Some of those programs are set aside for particular purposes, like there is a set aside for the Buffalo Psychiatric Center. Others are just based on the community's prioritization.
You have
So,
one question that came in regards to supported housing. Does supportive housing allow for young children to live with their parent who is in need of the housing?
yes. You're living in an apartment that is yours. The lease is in your name, and if you have a family, they live there with you. So licensed, I'm really glad that you asked that question, because one of the limitations of licensed housing is that you cannot have other household members with you. They support single individuals, whereas with supportive housing, if I am, I'm getting services, but I've got my husband and my kids, they get to live with me in this program. There are some differences between like the HUD and the OMH as far as like how they deal with who pays for what for household members, but overall, if you have a family, this is the program to go for. The other type of supportive housing is also funded by the state of New York. It's called ESHI. ESHI has homelessness requirements too, but they're more akin to the OMH supportive housing homelessness requirements, which are, do you need housing? They're not being specific about exactly what the circumstances are that you're living in, the way that HUD is. So when I say OMH supportive housing, you can also hear in your head ESHI, and that stands for the Empire State Supportive Housing Initiative. So we receive a referral for OMH or ESHI. We put the referral into an applicant pool. Based on the information you put into the SPOA referral, it will receive an auto-generated risk score. Thank God I don't have the time to go through with a calculator and do it myself. The SPOA MIS is a Salesforce based platform, and it does some auto calculating for us. This is one of them. How often in the last year, we know this because we ask you to put down a date, has you or the person you're working with been to CPAP, medical ER visits, psychiatric inpatient hospitalizations, medical hospitalizations, arrests, incarcerations, homelessness, lethality threats, and very, very important, if you or the person you're working with is subject to an assisted outpatient treatment court order, put that on the referral. There's too many people for Josh and I to know off the top of our head if they apply to it. And if you do, you go to the top of the list because part of Kendra's law is priority access for different types of supportive services. So it's really important on the SPOA referral to fill it out as completely as possible, because you can't just say, oh, they were at CPAP 4 times. It is a machine that's reading for like the number of rows where there's an ER visit. So if it doesn't count like 4 ER visits with 4 dates, it's going to count that text as 1. Like I said, 1,500 to 2,000 referrals a year. Josh and I, like Josh is good, but he is not, nor am I good enough where we can fix this. It needs to be done by the person submitting the referral. We also have critical time intervention programs. This is goal-oriented case management housing. So what I mean by that is and stuff like that, and it's designed to facilitate the transition out of institutional settings. So one of the things that research has found, that when you're stepping down out of an institution, those initial months afterwards are when you need even more support. Not instinct is often like, oh, well, they're doing well enough to go into, to better. I'm not going to worry about them. No. Worry about them. So it's someone coming out of a hospital, who jail, other examples. If we're coming out of long-term residential substance use, so the substance use, it's a year of case management, that's through Best Self, and out of homelessness, that's so shelter, hospital, jail, stuff like that. That's RSI, that's 6 months, but both would offer help with like a security deposit or a first month's rent, stuff like that. So when it says not a stipend, it's not like a monthly stipend the way that supportive housing is. Pilot program that the county is doing in partnership with Evergreen Health is substance use disorder transitional housing. So if the other programs are on ending homelessness, this is more of facilitating sobriety. If the obstacle to my sobriety is that I can't get stable housing, and anyone who's been in that position knows it's super, super stressful. Housing's the foundation of everything in life. If you don't have that, it's very hard to make positive progress on literally everything else. This program, it's 12 beds. It's meant to provide that stable support and then provide goal-focused case management towards job training, getting a job, building up your other supports for the substance use disorder recovery, other goals that you may have, stuff like that. It's only a year. So whereas supportive housing is permanent, like one of the very common causes of exit from permanent supportive housing is death, because, and they didn't just do anything, it happens to us all eventually. But this program is just a year of transition. And then last but not least, there is emergency housing. So emergency housing is for people with serious mental illness who are experiencing a housing crisis. It is a 10-bed mansion that TSI operates on the grounds of the Buffalo Psychiatric Center. Kind of has a vibe of very similar to Little Portion Priory, except for if everybody happened to have training with mental health and supporting that. If you are at TSI's emergency housing service, you are getting very goal-focused support in transitioning to housing. They will help you fill out applications. They will help you with landlords. And then the environment itself is conducive to folks who have mental illness and have different needs than maybe the general homeless population. Caveat, it's a long wait list. There's typically 30 to 40 people, 10 beds. I think all but 2 of the bedrooms are doubles. It's actually a really pretty building, like giant windows, really good natural light, does not feel institutional at all. So, and those referrals come through SPOA. All right, any questions before I transition to how to do the SPOA referral?
No new questions yet.
All right. So anybody can do a SPOA referral. If my most favorite person in the world to talk to about mental health issues is my next door neighbor can do a SPOA referral for me, presuming that she has my permission and support to do so. My husband thinks that I need some additional residential support, presuming that I'm willing to do this, he can do one for me as well. But with that said, the folks who will have the easiest time doing it are care coordinators, counselors, and homeless outreach workers. The common thread for these are people who are familiar with the bureaucratic processes of the mental health system. I could do one for myself if I wanted to, but I may struggle to get the information together. So anyone can do it. These folks will probably have the easiest time, but we're not dissuading anyone else from trying, really. And you do not currently have to be in Erie County. We recognize that we have a lot of people coming through our community who have family supports here. As long as you're going to receive treatment in Erie County and live in here afterwards, we're not going to say like, oh, well, you happen to be sent to the Binghamton Psychiatric Center because BPC was full. I'm sorry, guys. Like, we don't operate like that. All right, so support at eriespoa.org is for technical issues with the website. If you send me an email saying, hey, I can't log in for this reason, I'll be like, great. And then I'll forward your email to support at eriespoa.org, where our absolutely fabulous IT guy, Doug Nietzsche, who deserves a lot of credit for work he's done over the last 2 years to make the site more user-friendly, will help you out. He usually gets back to people within a day or so, and feel free to reach out. The website itself, eriespoa.org, and I am going to go there now. I'm not sure. Can you see the site loading? All right.
Yep.
Here we go.
Yep.
Things I would like to draw your attention to on the Erie SPOA website. The referral submissions button, the contact support button. We have an updates blog, so if you notice something changes and you're trying to figure out what happened, it's going to be listed there. Another reference to support at eriespoa.org. And then sign up here. So if you have never submitted a referral before, you will need to create an account. Pretty much, you click the button, it asks you your name, your email address to set a password, and then you're good to go. This right here, the Erie County Personal Information Consent Form, super, super, super important. We cannot do anything with a referral that does not have a written consent. We have not been able to accept verbal consent since the state of emergency in the state of New York ended in September last year. It has to be a written consent. And then also there is a SPOA manual. This describes how to do the referrals. The referral system changed last year. So I am going to log in. And I'm going to log in as housing@eriespoa.org, the email address that you can use to contact both Josh Curry Bascom and I. Hopefully it remembered my password because I didn't want to show you guys what that was. And now I do my best impression of Josh Curry Bascom, who I do not resemble, don't sound like, but he's fabulous and he's very helpful, and I would encourage you to reach out to him. So you get to this page and you're like, wow, there's not very much on it. That's correct. Click on referral submissions. On this page is where you will make a referral. So I am going to create a fake referral right now for the purposes of walking you through it. All right, on this page, please attach the general consent form below. You notice it's the first item we ask for. That is because without the consent, we cannot do anything with the referral. I'm bringing this up 8 times because for some reason, and I don't know why, in the last 6 months or so, we are receiving more referrals without consents than we are receiving with them. This is very time consuming for our office because it requires us to kind of chase people down. And we take an orientation where we don't want someone to miss out on housing because the person who's helping them is struggling to do a good job, for lack of a better way to say it. So if you want to facilitate a quick moving referral, make sure the consent is there. So again, there is a link to the general consent form. I'm going to click on it to show you. Got to fill out the name, fill out their date of birth, the records that you are, that not you, but the person who's being referred is willing to disclose, who they're willing to have it disclosed by, who it's willing to be disclosed to. When it expires, you have to have an expiration. We can't tell the difference between never expires and forgot to fill out the form, so we require everyone to have an expiration date. Upon the following event, it needs to be something that we can verify. So if you're a homeless service provider and you're like, until they're housed, we can look on HMIS and tell that they've been housed. But if it's something that we wouldn't necessarily know, like they're no longer part of your program, well, we can't tell if they're not working with you anymore, so that wouldn't be an event. Everybody's got a calendar. Everybody. Everyone can refer to a calendar. I recommend using a date. The most common thing is a year from when it was submitted. Any limitations on this one you can leave blank if it doesn't apply, because we'll know that. And then the client's signature. It can't be a typed name. It has to be a signature. It can be an Adobe e-sign. That's fine. And then attachment A is the entities that we can share the information to for the purposes of coordinating care. This is super important. I cannot say that this is important enough. We're spending way too much time tracking down consents. Have the consent. It is the first thing we ask for. All right. You want housing, you click on housing. Currently homeless, at risk of being homeless, we'll say they're homeless. All right, like I said, I'm impersonating Josh. It'll ask for your organization. You just start typing, something should come up. If your organization's not listed there, other. I'm going to pretend to be the assistant housing coordinator. There's Josh's phone number. If you're doing a referral on behalf of somebody else, so that would be like my colleague is on vacation and I just need to take care of this for her and I have the consent and the client's consenting to me doing it, you can click on this and it'll give their name. But generally speaking, it's best if the direct contact does it. And the reason for that is that updates about the referral are sent to whoever did the referral. All right. Josh requested this name, so I'm using it. And that's so Josh knows this is a fake person and he doesn't try to assign them to like TSI. It is most helpful if you're able to provide both their date of birth and their social security number. The reason for this is that we look through psyches to see if someone has a serious mental illness. Having both of those helps us find people. But I'm trying to be quick, so I'm just going to say date of birth. We ask for gender, race, and language. The reason we're asking for race is because we're trying to collect utilization data and to try to get a sense if there's any disproportionality between people in our community, people who have mental illness in our community, and who is seeking housing services, and then who gets housing services. So that's the reason we're asking for this. Same thing with gender. Primary language helps us help whoever is being served if that language is not English. We ask about if you've ever served in the armed forces because there is a veteran housing program through SPOA in the HUD homeless world. If you intend to have family members live with you, helps us figure out if you should or should not be in licensed housing. And then for your phone number, if you can include an extension, that is very helpful. I'm looking at you GBON folks. There's a lot of you. You call the general GBON number and it's a little tricky to get a hold of you unless we have the extension. So you can just write the numbers in and then just like X number, we'll be able to find you. But I'm just going to put Josh's phone number in. Current linkages. This helps us and this helps the people who are receiving the referral figure out who needs to be connected to the care. So I'm going to say I'm getting counseling at Best Self. I don't actually know the name of the counselor at Best Self, so I'm going to say that I'm connected to the Erie County Forensic Mental Health Unit, which is the counselors at the jail, and I'll say Chrissy Scott she's my old supervisor. And then any notes, phone numbers are helpful. Anything pertinent. This box right here, see this box. Is this client currently served with AOT court order? If that is your person, click this box. It is a magic box that opens many doors if it applies to your client because of Kendra's law. I'm not going to add another linkage for the sake of time. Current living situation. Be as specific as possible. If you don't notice that what they're in matches this, so let's say Dusty's in an Oxford house, we'll just make your best guess, give the date that they started there, and then give the address, and then in the notes section, Oxford house. Notes help us a lot. Notes help us figure out what's going on. Notes help you avoid a phone call from us trying to clarify things. Josh is lovely. There's no reason you should be dodging his phone calls, but it helps the referral go by smoother and quicker if we can just discern from the referral itself what needs to be accomplished. Functional strengths and deficits. Don't do what I'm doing now and just hitting next. Please fill this out because, again, this helps us help you figure out if somebody is a good fit for the potential program that you're seeking. Instances of lethality. This is important for the risk score, and this is important for us to know. I will give you a caveat that if you have a recent history of indiscriminate serious assault, a recent history of arson, a recent history of homicide, or a recent history of sexually abusing others, these two are usually rectified with treatment. It's going to be hard to place in a licensed housing setting because unless there is a compelling reason otherwise, there is a chance that they will be perceived as being a threat to the therapeutic environment. So if it's like, well, a history of setting fire, but they're on an AOT court order now, and the medication really makes that impulse go away, everyone is evaluated on a case-by-case basis. But, like I said, if I'm punching people for fun, not going to work out.
Couple questions, Christine.
Sure.
The first one, can you share the best way to refer a client that has pending charges in detained? Also, what changes may be deal breakers?
Okay, so I would recommend reaching out to Eddie Wayne and Cornelia. What's Cornelia's last name? I'm drawing a blank. They're discharge planners at the Erie County Forensic Mental Health. They can help you coordinate. And when I would say what charges are deal breakers, it's going to be hard to do. I've seen what happened a couple of times and it doesn't really work out is if somebody has like assault charges and they're trying to go to licensed housing as an alternative to incarceration, that's probably not going to fly because the receiving agencies are going to be concerned that this person who has a very recent history of assault may assault the other residents. Recent arson charges, arson is very, very hard to find a congregate setting willing to accept them. If it was in the past, let's talk, but if it was last week, probably not. Those two I would say. Recent history of homicide as well. Is very difficult to find a congregate setting for, but if I saw somebody who had manslaughter charges from like 15 years ago get accepted at an SRO, so it's not impossible.
All right, another question that came in as we were going through the last screen with the history questions. What is considered recent for the purposes of that?
It depends on the case. So when in doubt, if you've got the time to submit a SPOA referral and you've got the time to kind of work through the licensed housing screening, go for it. Let them say no. But I would say like if it was last week or yesterday, it was a year ago and they've been in treatment, or, you know, let's make the referral, have the conversation with the provider, and then see where it goes. Let them say no.
And we had a few people that chatted in that Cornelia's last name is Simmons.
Thank you. I appreciate you all.
But one other question. This one is, why is a SPOA needed for a transfer to a lower level of care within the same organization? For example, DePaul SRO to DePaul TAP.
That is a very good question. So the reason is because the county is responsible for making sure the beds are filled. With that said, if you submit a SPOA referral and you tell Josh internal transfer, he just accepts it. But otherwise, we would not know who's in the programs. We would not be able to tell which programs have the longest wait list, which ones are full, which ones are empty, and that is the reason why. But we're not going to, as long as there's a consent, we're not really going to scrutinize that.
And one last one, what about drug manufacturing charges? I think that goes back to the last question about charges.
That's a great question. Some buildings do have HUD imposed prohibitions against that. I don't know them off the top of my head. I would still submit the referral and let people say no.
And then just a thank you to Nicole. She put in Cornelia's contact information for anyone who needs it.
Awesome.
Thanks.
All right, so lethality episodes, this is another place where putting notes would be super helpful. I'm not going to do that because I'm looking at the clock and we're running low on time. I'm going to hit no, but these also count towards the risk score, so please fill it in. Insurance, I'm going to say no, but if you fill out the Medicaid number, that helps us track them in psyches. Diagnosis, these are the ones that lead to various programs. Check off what applies, and then put in additional information that's pertinent in the notes section. This note section actually shows up at the top of the referral when Josh and I look at it. So if there's something else that you want us to know, that's a great place to put it. Substance use and alcohol use information. If there's types of treatment, please fill this out. Hospitals and ERs, #1 reason someone has a high risk score. Again, please fill this out. So it's like what type of hospitalization, admission date, discharge date, and put in the facility. And then the type of housing that you want. So you choose either licensed, unlicensed, or emergency. I'm going to say licensed for this. And then the subtype, which are what we discussed earlier. If you have a question about it, feel free to reach out to Josh or I. I'm going to say first available. But some folks like really don't want to live in Gowanda. Gowanda's lovely, but their family's in Buffalo. So they'll check like everything but Stell. That's fine. Then it will load to this page and there will be a submit referral button up here. And you can kind of review everything there. So I am going to submit the referral and Josh is going to wonder, or maybe he'll laugh when he saw I actually took him up on making Dusty waitlist to be a person. So again, the consent form with that. And now it's submitted.
There's a few more questions. Christine, do you have time for them?
Yes, I do.
All right. One question that came in was, what if you don't have a discharge date or admission date?
Do your best talk to the client and get the most approximate dates you have.
And then the next one is, can you select more than one type of housing?
No, we only let folks do one type of housing at a time. And the reason is because we get 2,000 referrals a year. We would drown our providers if we had them doing multiple screenings simultaneously, because one person can only occupy one bed. So it's not efficient to have like all the supervised community residents, providers screen everybody and then hope they get there first when you can only go in one bed. And that is what Josh and I do to try to make it more efficient.
And last one is just a clarifying question about what's considered a young adult. It says earlier, young adult said 18 to 21, but the slide says under 25. Is there one that's correct?
21. The slide's a mistake.
All right, thanks.
All right. Ways to help for you to help us help you include all of the paperwork, especially the consent. Ensure the consent has a expiration date. If you have documentation of a serious mental illness, Psyches has a lag. We can't always see everything. Upload that with a referral. It needs to be a record or a letter signed by a qualified health professional. Include as much information as possible. If you do what I just did and just like fly through it, that referral has a risk score of 0. If you're applying for supportive housing, your client's going to be at the bottom of the list. Be as thorough as you can. And then if you get a new job, congratulations. If you have referrals, please let us know who the next contact should be. We'll make a note in it, because otherwise housing providers try to reach out to you in your old role and they don't know who to go to, and it makes it harder for them to find the client themselves. And then for the homeless service providers, if you happen to have verification of homelessness handy, upload it. If you happen to have the VI-SPDAT documentation handy, upload that. That does the housing providers a huge favor. All right. Once again, if you would like to reach out to us to ask questions, housing@eriespoa.org gets both me and Josh at the same time. Otherwise, that's Josh and my direct information. And thank you so much for having me.
Christine, that was fantastic. Kathleen, were there any other questions?
I was just going to say one last comment that came in that says for most health home care coordination, they will need the medical information. It was just a comment that was added.
Care coordination is not a housing issue, but if you are applying for care coordination itself, that's excellent advice.
That was all. Thanks.
So thank you, Christine. That was amazing. It was so informative and thorough. Thank you. Thank you.
My pleasure. And it was a lot. So if you have any questions, again, it is Josh and my job literally to help you get answers to them. So feel free to reach out.
Wonderful. And thank you, Kathleen, for managing all of the questions. And since Christine was able to manage all of the questions within the training, there will not be a follow-up document with questions and answers. So I did paste the link to the evaluation in the chat box and ask everyone to take a moment to complete that for us. Today's presentation will be posted on our webpage, which is erie.gov/mental health within the next couple days. Scroll down about 2/3 of the way down the page and you'll see the training collaborative box. Click on that and that will get you to all of the other trainings and upcoming events. I'd encourage you to mark your calendars for our next session, which is August 23rd from 12 to 1. More details to come on that. All of our sessions, our monthly training sessions, are the 4th Tuesday of the month from noon to 1. We'll be sending out notices for future sessions and check the website. Again, if you're interested in being a presenter, please let me know. If you have ideas for topics that you'd like to learn more about, we'd like to know that too. We will search the community for a provider who can present on whatever you're interested in. You can email me at amy.rockwood@erie.gov. And finally, thank you again, Christine, for such a wonderful presentation. Thank you all for coming and being part of our collaborative. And have a great day, and we hope to see you next month.
Amy, can you maybe post that eval link again? I don't see it in the chat on my end, and I want to just make sure it's not just me.
It's going to all attendees, not all presenters.
Okay. Good, just was checking.
Wonderful.
Thanks.
And I don't know if I said it, the recording for the presentation and the PowerPoint and the associated materials that Christine referenced will be posted on our website today or tomorrow, maybe Thursday. So next couple of days, you can check back there. Okay, and at this point, I am going to stop the recording.
Wonderful.
All done.
So,